Have you ever had one of those moments where you're reading something and the words just don't look as sharp as they used to? Maybe you clean your glasses, thinking that's the problem. But even after cleaning them, things still seem slightly cloudy, almost like there's a thin layer of fog you just can't wipe away. Or perhaps you've noticed something different when you're driving at night. Headlights seem brighter than before. They spread out more. Sometimes you even see a kind of glowing ring around them, what many people describe as a halo. Now let me ask you something. Have you ever thought to yourself, maybe this is just part of getting older? That's a very common thought. In fact, most of the patients I speak with say exactly that. They assume that changes in vision are simply something they have to accept. But here's where I want you to pause for a moment. Because while aging does affect the body, not every change should be ignored. Some changes are signals, and your eyes are very good at sending signals. What you're experiencing may not just be getting older. It could be the early stage of something very specific, something very common, and something very manageable, especially when caught early. That condition is called a cataract. Now, I want to be very clear here. Cataracts do not usually cause pain. They don't happen suddenly, and they don't announce themselves in an obvious way. Instead, they develop quietly, slowly, almost like a window in your home that gradually becomes cloudy over time. At first, you barely notice it. Then one day, you realize the sunlight doesn't come through as clearly as it used to. That's exactly how cataracts behave. And this is why so many people miss the early warning signs. Because the changes are subtle. They creep in little by little. Now here's why this matters, especially for you if you're over 60. Your vision plays a major role in your independence. It affects how safely you can drive, how confidently you can walk, how easily you can read your medications, even how connected you feel to the world around you. So when your vision starts to change, even slightly, it's worth paying attention, not with fear, but with awareness. Because early awareness gives you options, it gives you time, and it gives you control. Now, before we go further, let me properly introduce myself. Hello, I'm Dr. Robert Miller, and over the years, I've spent a great deal of time not just treating patients, but also reviewing medical research. Because medical knowledge is constantly evolving. New studies are published, new insights are discovered, and my role is to take all of that information and translate it into something simple and useful for you, especially for those of you in your 60s, 70s, and beyond. Because let's be honest, most medical information today is not explained in a way that feels practical. It can feel overwhelming, complicated, sometimes even confusing. So my goal is different. I want to sit with you, just like I would in a clinic, and explain things in a calm, clear, and honest way. No complicated terms, no unnecessary details, just what you need to understand, and what you can actually do about it. And today, we're focusing on cataracts. We're going to break this down step by step, what they are, why they become more common as we age, and most importantly, the early warning signs that many people overlook. Because once you understand those signs, you start seeing things differently. You start noticing changes earlier, and that can make a real difference. Now, before we continue, I want to gently mention something. If you find this kind of explanation helpful, if you prefer health information that is calm, simple, and based on real medical understanding, you might consider subscribing to the channel. There's no pressure, but it does help us continue creating content specifically designed for people over 60. Reliable information, clear explanations, and practical guidance you can actually use in your daily life. Now, let's take a moment to look at what you can expect from this video, because I believe it's always helpful to know where we're going. First, we'll talk about what cataracts actually are, not in complicated medical language, but in a way that makes sense in everyday life. Then, we'll look at why they tend to appear more often after the age of 60, what changes inside the body, and why those changes affect your eyes. After that, we'll go through the early warning signs, and this is very important, because many of these signs are easy to overlook. They don't feel serious at first, but recognizing them early can make a significant difference. And finally, we'll discuss simple daily habits, things you can realistically do, not extreme changes, not difficult routines, just practical steps that may help support your eye health over time. So, as you listen, I'd like you to keep one simple question in mind. Have I noticed any of these changes in my own vision? You don't need to analyze anything, just observe. Because sometimes, awareness is the first and most important step toward protecting your health. And by the end of this video, my goal is for you to feel more informed, more confident, and more in control of your vision moving forward. Let's take this step by step in a very simple way. Inside each of your eyes, there is a small, clear structure called the lens. You can think of it just like the lens in a camera. Its job is to take light from the outside world and focus it so you can see a clear image. When you are younger, this lens is perfectly clear. Light passes through it easily. Images look sharp, colors look bright, and your vision feels effortless. You don't have to think about it. But over time, something very gradual begins to happen. The lens starts to lose that perfect clarity. It doesn't happen overnight. It doesn't suddenly turn cloudy. Instead, it's a slow process. So slow that most people don't notice it at first. Let me give you a simple picture. Imagine you have a clean window in your home. On day one, it's completely clear. You can see everything outside perfectly. Now imagine that every day, a tiny bit of dust settles on that window. Not enough to notice right away. But over weeks and months and years, that dust builds up. Eventually, the window looks slightly cloudy. Not completely blocked, just not as clear as it used to be. That is very similar to what happens inside your eye. The window of your eye, the lens, slowly becomes cloudy. And that cloudiness is what we call a cataract. Now here's something important I often tell my patients. This is not just about weak eyesight. It's not simply that your eyes are getting tired. It's that the lens itself is changing. So even if you update your glasses, even if you try different lighting, the problem doesn't fully go away, because the issue is not outside the eye. It's inside the lens. Now let's talk about why this becomes more common as we age. Because this is where many people say, why now? Why after 60? Inside the lens, there are tiny building blocks called proteins. You don't need to remember that word. Just think of them as the material that keeps the lens clear. When you're younger, these proteins are neatly arranged, almost like a perfectly organized stack. Light passes through them easily. But over time, these proteins begin to change. They start to break down. They begin to clump together. And when they clump together, they scatter light instead of letting it pass through cleanly. Let me simplify that even more. Imagine shining a flashlight through clear glass. The light passes straight through. Now imagine that glass becomes slightly dirty or uneven. The light starts to scatter. It spreads out. It becomes blurry. That is exactly what happens inside the eye with a cataract. Another way to think about it is this. Picture a glass of clean water. Now, slowly add tiny particles into it over time. At first, the water still looks clear. But as more particles collect, the water becomes cloudy. That cloudiness is gradual, and that's why cataracts are gradual too. By the time someone reaches their 60s or 70s, these small changes have been building for years. That's why cataracts are so common at this stage of life. Now, I want to briefly connect this with what research tells us. Organizations like the National Eye Institute have studied this very carefully, and what they've found is quite straightforward. Cataracts are one of the most common causes of vision changes in adults over 60. In fact, if someone lives long enough, it is very likely they will develop some level of cataract. Now, that might sound concerning at first, but here's the reassuring part. Just because something is common does not mean it has to be ignored, and it certainly does not mean you lose control over your vision. What makes the biggest difference is awareness, recognizing the early signs, understanding what your eyes are telling you, and taking action at the right time. So now, let's talk about those early signs, because this is where many people miss important clues. I want you to listen carefully and ask yourself, have I noticed any of these? The first sign is blurry or cloudy vision. This is usually very subtle. You may feel like things are just not as sharp as before. Maybe you clean your glasses more often. Maybe you think the lighting in your home is the problem, but the slight blur remains. That's often the first signal. The second sign is increased sensitivity to light. Bright sunlight may feel more uncomfortable. You may find yourself squinting more than usual. Headlights at night may feel too intense, almost like they're overwhelming your eyes. The third sign is seeing halos around lights. This is something many patients describe very clearly. They say, "It looks like there's a glow around lights," especially at night. Street lights, car headlights, even lamps. This happens because the cloudy lens scatters light. Instead of a clean point of light, you see a spread out ring. The fourth sign is difficulty seeing at night. Driving at night becomes harder. You may feel less confident. Objects seem dim. Edges are not as clear. And this can affect safety, which is why it's important not to ignore it. The fifth sign is changes in how you see colors. Colors may look faded, less vibrant, sometimes slightly yellow. You may not notice it immediately, but when you compare things over time, the difference becomes clearer. And finally, one sign that often surprises people: frequent changes in your glasses prescription. If you find yourself needing new glasses more often than usual, it may not just be your vision changing. It could be the lens itself continuing to become cloudy. Now let me pause here and ask you something. Have you experienced even one of these signs? If the answer is yes, you're not alone. And it doesn't mean something is wrong beyond repair. It simply means your eyes may be going through a very common age-related change. And the key message I want you to take from this is very simple. Cataracts develop slowly. The signs are subtle, but they are there if you know what to look for. And once you recognize them, you are in a much better position to protect your vision moving forward. Let's slow this down and understand what's really happening inside your eyes in the simplest way possible. Because once you understand why cataracts develop, everything else starts to make more sense. I'm going to walk you through 3 main reasons, not complicated science, just clear ideas you can picture in your everyday life. Let's start with the most important one. Inside the lens of your eye, there are tiny building blocks, proteins. You don't need to remember that word. Just think of them as the material that keeps your lens clear and smooth. When you're younger, these proteins are perfectly arranged, almost like a neatly organized stack of glass sheets. Light passes through them easily. Everything looks sharp. But over time, these proteins begin to change. They don't stay neatly arranged. They start to stick together. They form tiny clusters. Now imagine this. You have a clear piece of glass, and someone places small smudges on it. At first, you barely notice. But as more smudges appear, the glass becomes cloudy. That's exactly what happens in your eye. These protein clusters block and scatter light. So instead of light passing straight through, it spreads out. And that's why your vision starts to look blurry or hazy. Now here's why this matters, especially after 60. These changes don't happen all at once. They build up slowly over decades. So by the time you reach your 60s or 70s, there's been enough buildup to start affecting your vision. And this is why many people say, "It feels like my vision is just not as clear anymore." The key takeaway here is simple. The lens is not as smooth and clear as it used to be, and that affects how light enters your eye. Now let's talk about the second reason. This one may sound technical, but I'll keep it very simple. Oxidative stress. All this means is that certain harmful particles slowly damage your cells over time. Think of it like rust forming on metal. You don't see rust appear in one day. It develops slowly, but once it starts, it gradually weakens the structure. The same idea applies inside your body, and yes, inside your eyes. Over time, these harmful particles can affect the lens. They damage its structure, they reduce its clarity, and they make it more likely for those protein clumps we talked about to form. Let me give you a simple, everyday example. Imagine leaving a clear plastic item out in the sun for years. At first, it's perfectly transparent, but over time, it becomes slightly yellow, slightly dull. That's a similar effect. Now, why is this more important after 60? Because your body's ability to protect against this kind of damage naturally decreases with age. When you're younger, your body handles this damage more efficiently. But as you get older, that protection becomes weaker, so the damage builds up faster, and that contributes to cataract formation. The key idea here is your lens is slowly being affected by long-term wear and tear. Now let's look at the third reason, and this one is very important. Your body has a natural repair system. When you're younger, it works very efficiently. Small damage gets fixed quickly, cells stay healthy, everything stays in balance. But as we age, that repair system slows down. It doesn't stop, but it becomes less efficient. Let me explain it like this. Imagine a small crack in a wall. When you're younger, it gets repaired immediately, no problem. But as time goes on, repairs are slower. Some cracks are left unattended. Over time, those small cracks add up. That's what happens in the lens of your eye. Small changes occur, small damage happens, but instead of being fully repaired, they remain. They build up, and over time, they lead to cloudiness. This is one of the main reasons cataracts are so closely linked to aging. It's not just damage, it's the body's reduced ability to fix that damage. So let me summarize these three ideas for you in a very simple way. The lens material becomes less organized. The lens experiences long-term wear and tear, and the body becomes less efficient at repairing it. All three together lead to the gradual clouding of the lens. Now, let's shift gears, because the most important question is this: what can you actually do about it? And I want to keep this very practical. No complicated routines, no unrealistic expectations, just simple habits that can support your eye health. Let's start with sunlight. Your eyes are sensitive to long-term exposure to UV light. That's the invisible part of sunlight. Over time, it can contribute to damage in the lens, so something very simple can help. Wearing sunglasses when you're outdoors, not just for comfort, but for protection. Choose sunglasses that block UV rays. Think of them as a shield for your eyes. Now let me ask you, do you usually wear sunglasses when you go outside? If not, this is one small habit that can make a difference over time. Next, managing chronic conditions. Conditions like diabetes can speed up changes in the lens, especially when blood sugar is not well controlled. So if you have diabetes, keeping your blood sugar stable is not just about general health, it's also about protecting your vision. Another important factor is smoking. Smoking increases that wear and tear process we talked about earlier. It adds more stress to your body, including your eyes. So, reducing or avoiding smoking can help slow down those changes. Now let's talk about something very simple: lighting in your home. As your eyes change, they need more light to see clearly. So improving lighting in areas where you read, cook, or move around can reduce strain on your eyes. This doesn't fix cataracts, but it helps you function more comfortably. And finally, regular eye checkups. Even if you feel your vision is good enough, because early changes are not always obvious. An eye exam can detect things you may not notice yet, and early detection gives you more options. Now let's briefly talk about food. Not a strict diet, just helpful choices. Leafy greens like spinach and kale contain nutrients that help protect the lens. Carrots and orange vegetables support general eye function. Fish like salmon support the surface of the eye and overall eye comfort. And citrus fruits like oranges help protect against long-term damage. You don't need to eat perfectly. Even small improvements can help over time. Now let's be realistic. Cataracts don't disappear overnight, and no habit will reverse them instantly. But here's what you may notice. In the first few weeks, your eyes may feel more comfortable, less strain, better adaptation to light. After a month or two, your vision may feel more stable, less fluctuation. And over several months, you may slow down further progression by managing risk factors. The goal here is not perfection. The goal is protection. Before making changes, always speak with your doctor if you have diabetes, you're taking medications that affect your eyes, or you already have significant vision problems. And remember this: if cataracts progress to the point where vision becomes difficult, there is a very effective treatment: cataract surgery. It's one of the most common procedures today, and for many people, it restores clear vision. Let me leave you with this: cataracts are common, especially after 60, but they are not something you have to ignore. Your eyes are giving you signals, small ones, subtle ones, and when you pay attention to those signals, you stay in control, you protect your independence, and you maintain your quality of life. You don't need to do everything perfectly. You just need to stay consistent. Before you go, I'd really like to hear from you. Have you noticed any of these changes in your vision? Or what was the most helpful thing you learned today? You can share your thoughts in the comments. And if you have a question, there's a good chance it could be answered in a future video. Take care of your eyes, because they help you stay connected to everything that matters in your life.